If you're over 50 and your erection fades right when things are getting good, what I'm about to share could change everything for you. Because the truth is, most men think it's low testosterone. They think it's poor blood flow. They think it's just age. But in most cases, it's none of those. It's a simple mechanical mistake almost every man makes without even realizing it. And once you understand this, you'll never look at your erections the same way again. Before we go deeper, if you're a man over 40, 50, 60, or beyond, and you care about your strength, stamina, and confidence, make sure you like this video and subscribe to Dr. Emily Men's Vitality. I share practical, science-based guidance made simple for real men who want real results. And I'd love to know, comment below your age and tell me honestly, does your erection fade too quickly? Or does it stay strong? Your comment helps other men realize they're not alone. Now let's talk about what's really happening. I'm Dr. Emily, men's health educator and wellness researcher with many years of experience studying male vitality, energy levels, and age-related health challenges. My work focuses on turning complex medical research into clear, easy guidance for men over 40, 50, 60, and 70. And one of the most common issues I see is this: men who can get hard but can't stay hard. You start out fine, you feel aroused, you get firm, you feel confident, then somewhere in the middle, maybe during a position change, maybe when stimulation slows down, you feel it. The strength drops. Not completely soft, just weaker. And the more you notice it, the worse it gets. You start thinking, trying harder, forcing it, and that pressure makes everything spiral. Most men immediately blame blood flow. But here's the surprising truth. In many cases, blood is entering just fine. Now, the real problem is that your body isn't trapping that blood effectively. An erection has two main steps. First, blood flows into the spongy tissue of the penis. That's what creates firmness. But the second step is just as important. Your body has to trap that blood inside. If it leaks back out too quickly, your erection fades, even if arousal is still there. And this is where age plays a quiet role. At the base of the penis are support muscles, especially the pelvic floor muscles that help compress the veins and lock blood in place. When you were in your 20s and 30s, those muscles activated automatically. They were strong, responsive, and tight. You didn't have to think about them. But after 50, those muscles often lose tone. They become weaker and slower to engage. So what happens? Blood flows in, you get hard, but the lock isn't strong enough. Blood slowly leaks back out, and your erection fades faster than you want. And this is why some men stay firm for 20 or 30 minutes with no problem, while others struggle to maintain hardness for more than a few minutes. It's not always about desire. It's not always about hormones. It's often about muscle activation. Let me ask you something. Do you need constant stimulation to stay hard? The moment things slow down, does your erection weaken? Do you lose firmness when switching positions? If you said yes to any of these, your issue may not be arousal. It may be support muscle activation. Here's the good news. This is fixable, and it doesn't require pills, injections, or expensive devices. You need to activate and strengthen the muscles that help trap blood before intimacy begins. Think of it like warming up before lifting weights. If you try to lift heavy without warming up, your muscles don't perform at their best. The same thing happens here. If you don't wake up those support muscles, they may not engage strongly when you need them most. So here is a simple activation technique you can try. First, identify the correct muscle. Imagine you are trying to stop urination midstream. The muscle you tighten in that moment is part of your pelvic floor. That tightening feeling at the base is what we're targeting. Now sit or stand comfortably. Gently contract that muscle. Not your stomach, not your thighs, just the internal lifting muscle at the base. Hold the contraction for 3 seconds. Keep breathing normally, then fully relax for 2 seconds. Repeat this 5 to 6 times in a row. 3 seconds hold, 2 seconds relax. Slow and controlled. The entire process takes about 30 seconds. When you do this shortly before intimacy, you're priming those muscles. You're telling your body, get ready. When arousal begins, those muscles respond faster and contract more firmly. That stronger contraction helps trap blood more effectively, which can lead to a firmer, longer-lasting erection. Over time, and if you practice this a few times a week, those muscles become stronger overall. Just like any other muscle group, repetition builds tone, and stronger pelvic floor muscles are linked to better erection quality and control. Now, I want to be clear about something important. Erections are influenced by many factors: stress, sleep, cardiovascular health, medications, and emotional connection all matter. If you have persistent erectile issues, pain, or underlying health conditions like diabetes or heart disease, you should absolutely speak with a qualified health healthcare professional. What I'm sharing here is educational guidance, not a replacement for personal medical care. But for many men, especially those over 50 who can get hard but struggle to maintain firmness, muscle activation makes a noticeable difference. Another thing most men don't realize is that anxiety makes this worse. The moment you feel yourself fading, your brain shifts into performance mode. And that stress response releases adrenaline. And adrenaline works against erections because it tightens blood vessels and shifts your body into alert mode instead of relaxation. So the more you panic, the faster things fade. That's why confidence and preparation matter. When you know you've activated your muscles, when you know your body is ready, you feel calmer. That calm state supports better performance. Also, pay attention to your overall health. Walking daily, maintaining a healthy waistline, managing blood pressure, and getting enough sleep all support erectile quality. The penis is a vascular organ. What's good for your heart is good for your erections. Let's quickly recap. If you can get hard but lose strength too quickly, it may not be age, it may not be testosterone, it may not even be blood flow. It could be weak or underactivated pelvic floor muscles that are failing to trap blood effectively. A simple 30-second activation routine before intimacy, combined with regular strengthening practice, can help improve firmness and staying power over time. Try this consistently for a few weeks. Pay attention to how your body responds. Notice whether you need less constant stimulation. Notice whether position changes feel easier. Awareness is powerful, and remember, your body is not broken. It may just need the right kind of support and training. If this video helped you understand something new about your body, press like so more men can see this. Subscribe to Dr. Emily Men's Vitality for weekly guidance designed specifically for men over 40, 50, 60, and beyond who want to stay strong, confident, and energized. And before you go, I want you to comment below and answer this. Do you think your challenge is getting hard or staying hard? Your answer might help another man reading the comments feel less alone. Share this video with a friend who might need it. Many men struggle silently. Sometimes one honest conversation can change a life. I'm Dr. Emily. Your vitality does not disappear with age. With the right knowledge and the right habits, you can support your strength at any stage of life. I'll see you in the next video.